I'm Dr. Harrison Davis.
And I'm Dr. Aisha Dickerson.
And you're listening to Two Therapists and a Microphone. Hey, I want to welcome you guys to today's episode of Two Therapists and a Microphone. And today we're going to talk about an important topic that's affecting the Black community. We're in the holiday season, and I'm getting ready for all the holidays and a Thanksgiving dinner. Are you getting ready for yours, Aisha?
I am, but I have to admit that something I think about every time I'm coming up on Thanksgiving is how I'm not going to gain weight or what I'm going to do to lose the weight that I gained during Thanksgiving.
So I know a lot of people are monitoring what they're going to eat throughout the holidays, and now I'm reading these stories about eating disorders within the Black community, and I'm curious about how it is truly affecting us. We don't get to hear about eating disorders within the Black community a lot. There's a lot of research out there on eating disorders, but they fail to mention or include ethnic minorities, particularly Black folks, or even people with a low socioeconomic income.
Yeah, I know when a lot of people think about eating disorders, first thing that comes to mind is probably, honestly, the anorexic white girl.
Yes.
Maybe the bulimic white woman.
It's a white woman's problem.
Right. Eating disorders has historically been considered a white woman's problem.
But it's not.
Apparently not. Last time we were here, we talked to Dr. Burwell, and for the first time on Two Therapists and a Microphone, we are bringing back a guest because Dr. Burwell works with people with eating disorders. For those of you who may not remember who she was from last time, Dr. Burwell is a licensed professional counselor and owner of Enchanted Therapeutic Counseling Services. Crystal is a native of Raleigh, North Carolina, where she received her doctorate from North Carolina State University. She is a member of the original NBCC MFP Fellowship and has a passion for helping people live authentic lives and focuses on wellness and positive psychology. Her clinical specialties include eating disorders, substance abuse, mood and anxiety disorders. She has a new focus on bariatric care and will be launching binge eating and bariatric groups beginning November 2017. I guess that means you've started them now because this is November 2017. Lastly, Crystal teaches graduate counselor education courses at Messiah College in Richmond Graduate University and is a member of the editorial review board for The Professional Counselor. You can check Dr. Burwell out at enchantedtherapeuticcounseling.com. Welcome, Crystal.
Yeah, thanks for having me back. I'm doing well. I'm happy to be here.
Yeah, it's good to see you again.
Thank you.
I'm glad you're back. And I also want to introduce our second guest for today's show. That's Carlos Houston. He has over 20 years of diversified experiences in mental health, and he's the professional relations manager for Veritas Collaborative, which is a specialty hospital for the treatment of eating disorders. Carlos is originally from Alabama, and he loves performing arts and spending time with his family. Welcome to the show, Carlos.
Thank you, sir. It's a pleasure to be here.
All right. Thank you, guys. So now we're talking about eating disorders and Black folks, So tell us, what is the state of healthy eating for Black folks in this country? Tell us, what do you know about that?
Well, the state of healthy eating, I think it's a crisis, an epidemic in terms of how eating disorders are manifesting in people of color, in terms of what we eat and how we prepare food is very different from other cultures. So it's no wonder how our eating is different and how eating disorders manifest differently in the Black community.
What are you seeing out there, Carlos?
I think a lot of it has to do with kind of what you just said, the state of healthy eating, because oftentimes I think we are more now in a position where we are working to eat healthy. I don't think my grandmother ever thought about, am I eating healthy? I don't think that ever crossed her mind growing up. I don't think that crossed our ancestors. They ate with the food that we had. We enjoyed eating.
Earth.
Right, from the earth, it was just more of food, the place that food had. Every celebration was around food, everything that we did. I think part of it is as we have involved in the American culture, not necessarily Black culture, but just in the American culture, there's certain aspects of it that now we are more focused on eating healthy. And the issue with that is we all define healthy differently. And you can Google what healthy is. You can talk to 101 different specialists. You're going to get 101 different answers. What is healthy? So a lot of times we are defining that in our own ways based on limited information. And then there's the quick fixes. You know,
Right. All these fad diets.
exactly. And I think that has a lot to do with it. Where it's not necessarily about eating healthy; it's about how do I look the way I want to look. For a lot of people, I know with eating disorders, it's not always about body image, but there are times when that is a large part of it.
So, Dr. Burwell, I heard you say when it comes to the African American community that you were, and I may have heard this wrong, but thinking or focusing on healthy eating and binge eating. So, when we talk about eating disorders with the African American community versus other communities, what's the difference?
Well, the research shows that African Americans are disproportionately affected by binge eating disorder, so which is relatively new to the DSM-5. So before we were really focusing on restriction and purging compensatory behaviors, but what we're finding is that Black people, especially African American men, are diagnosed at rates of at binge eating rates much higher than any other group.
Okay.
So that, for me, says that it's not always just about healthy eating, but for Black people, eating is a way of coping.
So it sounds like it's a serious issue with Black men, and I'm also assuming with Black women as well. Why don't you tell us and make sure the audience is aware, what is binge eating? What do you mean by that?
Yeah, that's a great question. So people tend to confuse overeating and binge eating. So, for example, what we typically do around the holidays coming up, Thanksgiving, is overeat, right?
Yeah.
So you might have a plate and a half or 2 plates. However, that's not a binge, right? A binge is when you consume like 2,000 to 3,000 calories or more.
That sounds like my Thanksgiving.
Sounds like mine too.
But the difference is it's in a really short amount of period of time, and then it's the lack of compensatory behavior. So, such as exercising, purging, anything to get those calories off.
So an example of binge eating can possibly be that person who's eating a large meal in the morning, in the afternoon, for dinner, and still snacking throughout the day. They're eating much more than they should, and they're
Right.
not doing anything to keep their body weight at a healthy place.
Absolutely. And also the intention is different. So it's not necessarily just eating to eat, but eating to cope, right? So
Okay.
you're eating as a way to cope with negative emotion, potentially negative body image, like Carlos was saying. So there's something underneath the food, and that's what I'm treating as the emotion.
There's a reason behind eating
Oh,
besides
yeah.
I'm hungry.
Oh, right. Absolutely. Absolutely. People are really hungry for something else.
And oftentimes you'll have that restricting that you also see with anorexia. You'll have the restricting where I'm not going to eat, I'm not going to eat, I'm not going to eat. And then when they finally eat a cracker, which that 0 or 100 mindset kicks in, well, I've already eaten a cracker, so I might as well eat. Now, instead of eating a sensible meal or instead of eating just overeat like we do for Thanksgiving, but is eating a portion that would be more in line with for 4 people. Eating that much over a small period of time, eating enough for 4 people in 45 minutes. And I'm saying that you were asking like someone who eats 3 times a day or 4 times a day plus snacks, is that binge eating? So there's overeating where you eat large portions. That's one thing. But I think like what Krista was saying, a lot of it has to do with the reason why they're eating and then the amount and then the frequency of this. Are you doing this once a year for Thanksgiving, or are you doing this 3 times a week or 4 times a week? And how is the restricting and the binging planned together?
So it's like a cycle that the person goes through. Yeah, I can remember a few years ago, I had a client, and she was a 22-year-old white woman, and she had come in to talk to me in my counseling practice, and she told me that night before, she ate 4 pizzas. 4 large
whole pizzas,
pizzas.
okay.
And I was amazed. I actually thought she was joking about it because she was about 5'7", maybe 122 to 120 pounds or something like that. I was amazed that she was able to swallow and digest 4 pizzas, whereas for me, 4 slices is enough for me. And then she quickly let me know where I didn't keep it down. So that was sort of my introduction to a real live person experiencing some type of eating disorder. But again, I hadn't seen it in any of my clients of color. So can you tell us more about body image issues and how that might be contributing to some of this binge eating or restrictive behavior?
I think a lot of it has to do with who is actually seeking help, and I'm saying it to address like what you're saying as far as this has primarily been looked at as a affluent young white female disorder, and that stigma by itself has hindered a lot of individuals, males, females, or males of all races. From seeking help, simply because it is looked at as a female disorder. And you know how men are. If that lotion smells sweet, I'm not using it. I just have ashy hands all day.
Gotcha.
So it's kind of like, no, I'm not going to seek help for this because that's a woman's disorder. And because of that shame that may be associated with, there's a lot of shame. And I think that's a big part of eating disorders, regardless of who you are, the shame, the guilt, the self-loathing that's associated with it. But when you're dealing with males in a society that has already deemed this to be a female disorder, that automatically means I can't seek help for this. And we have that, the toughen up, man up, you'll be okay.
So they don't even recognize that they're having that problem.
Correct. I've had patients referred to our clinic, whereas the pediatrician would refer a young male, and the note from the pediatrician would say something in the sense of it looks very much like eating disorders. If he wasn't a male, then I would assume, and this is from pediatrician, this is from doctors. So I work with a lot of professionals on a regular basis who still kind of maintain that old thought of this is a female's disorder. But as far as culturally, it's generally known that we as a culture, Black people, do not quickly go to seek mental health care.
Right.
So it's not, I think, like our lack of presence in the field of eating disorders correlates right with our lack of presence in the field of mental health. We're not seeking the help that we need. Oftentimes it's something that, it's a lack of understanding. And with eating disorders, people don't self-disclose. They're more quickly to tell you that they have sexual trauma in their life than they are to tell you, I have an eating disorder. And so because of that, it's easy to hide this. It's easy to...
And ignore it.
Everything happens behind closed doors. It's easy to hide, it's easy to ignore. You cannot look at a person and tell they have an eating disorder. You cannot look at them. They can be super thin or they can be grossly overweight. It's you can't determine that. So people are able to hide it and just kind of live in that shame by themselves.
So, Carlos, you made a good point that you don't see a lot of African Americans or men even working in the field of eating disorders. So can both of you tell me what got you into the field?
You're right. There's not a lot. There's not a lot of people that look like us in this field, and that's why I adore Carlos, because he's like a unicorn. So working in this field, I think there's, like you were saying, there's not a lot of people of color that are coming for treatment. And then when you come for treatment and you don't see people that look like you, I think that's harder. I got into the field on accident. So I was trying to expedite my LPC and get licensed sooner. And I had a friend who was working at Carolina House, and she was like, oh, you can, pick up some PRN work and get experience in eating disorders. And I was like, what is an eating disorder? Like, I don't even... I couldn't fathom it until I saw it. And I was like, this is a real thing. And so it kind of stuck. And it's lucrative.
I had the pleasure of working with patients in the past who had eating disorders, whereas it would be a secondary to something else they had going on. It wasn't primary. This was years ago when I transitioned from patient care over to business development a few years ago. And Veritas Collaborative was looking at having a presence in the Atlanta and in the Southeast market, which is, as you said, is a specialty hospital for the treatment of eating disorders. I kind of went through my mindset of what experience I've had in eating disorders. And I thought, okay, this would be great. But it wasn't until I came on board at Veritas and actually started learning more and looking at the research and the best practices and everything that has been shown, and I want to say over the past few years, a very small period of time, because eating disorders is fairly new, actually. Not new in the disorder, but new in the research and the understanding that we have of it now. Mm-hmm. There's so much that we are learning. Just the DSM was changed in 2013, and went from the DSM-4 to the DSM-5. The DSM-4 was horrible in how it addressed and categorized eating disorders. And a lot of that was corrected in the DSM-5. They added binge eating disorder. They added ARFID, avoid restricted food intake disorder. They added OSFED. But they also corrected some of the things like anorexia. Anorexia was listed as one of the characteristics you had to have was you had to have a period of amenorrhea, which is a loss of your cycle. Well, if that's the case, then no man can ever have anorexia.
Ah.
So little corrections like that really made a big difference in the DSM-5. It made a big difference in the treatment. It made a big difference in being able to bill insurances. It just a lot of that. But to answer your question, when I came on board with Veritas, I learned so much more. I learned it had the highest mortality rate of any other mental illness. Never knew that. Never even crossed my mind. Never thought about it. And I think most people don't realize that. The highest mortality rate of any other mental illness is eating disorders, specifically anorexia. Yeah. So being able to look at that and that information, it's like, why aren't we talking about this more? Why aren't we? And it's because of the stereotypes associated with it. And for us as a people, the biggest stereotype is that's white people's disorders.
Gotcha.
We don't have that issue. And that's the furthest thing from the truth.
So I'm glad that you guys have a lot of exposure with it. So let's start off by talking about what are some of the myths about eating disorders, binge eating, anorexia, bulimia. What are some of those stereotypes? You mentioned one is that it is perceived to be a white woman's problem. But what are some other barriers that are keeping Black folks from seeking help with this or even being identified as someone who is experiencing some type of eating disorder? What are those myths or stereotypes that you heard about?
Well, I mean, I think the main one that we spoke to was that it's the face of eating disorders or disordered eating is a thin, frail-looking white woman. However, most of the people that I treat are more overweight and tend to be people of color. And to piggyback on what Carla said, I think the DSM-5 inclusion of binge eating disorder has really helped treatment significantly. However, we still have major barriers like being able to, afford treatment because insurance companies don't pay for binge eating disorder treatment at the rate that they will pay for treatment for anorexia, bulimia, any of these other issues. So I think the fundamental problem is African American culture is uneducated about what disordered eating really looks like. If you, like, for example, every time I go home, I go to church and people want to feed me. And after church, there's all these, like, I mean, you can't get away from food, right? And people don't even understand how their eating is disordered or how to change it. And then even when they have the educational piece, then it's like, okay, if I have this issue and I want to seek help for it, but insurance isn't going to cover it, so then what? And then it's easy to just go back to eating as the coping.
Gotcha. So I heard you talk about eating and going to the church. Food is a big part of our culture. And Carlos, you talked about a little bit earlier. How is that helping us to have our families and relationships all surrounding food or the preparation of food? And within the Black family, this is how we show care for each other sometimes. How is that helping us to have this strong connection with food within the Black family?
Something that I think kind of correlates. Let's take a family that that has a very strong drinking history, and I don't mean drinking as far as in abuse or in excess, but drinking.
It's part of the family
it's
culture.
Part of the family culture. The men like scotch, and they all the men come together over the holidays and they drink scotch, and it's just part of it. Drink scotch and smoke cigars, and that's part of the family culture. They've been doing this for years. Well, here comes along someone who is an alcoholic in the family. And now he's not able to participate in that part of the culture. Is the family going to embrace him and say, "Oh, it's okay, come on over here," and or they're going to look at him, he's going to be ostracized. He's going to look at as he's different, as he can't hang with the rest of the men, or he can't partake. And so because he wants to be in the house with the women, because he doesn't feel comfortable outside with where everyone's drinking, how is he perceived in that family dynamic? Where does he fit in? And is he going to be accepted? Now, that's alcohol. Now take that same story and put it with food. Here's this individual who has a major issue with food, has a major issue in a family where food is a part of everything that we do, yes, every celebration, every holiday, but this person doesn't have the same emotional connection to food or has a very different just view and concept of food and how it is for their body. So where are they going to fit into this family structure, and how are they going to be looked at? And I think that's a lot to do with what hinders us from seeking the therapy and treatment we have, because we're so different from what is looked at to be the norm.
So not wanting to damage or alter some of those family relationships, although they're experiencing something with the food that's causing some problems, they don't want to feel like an outsider.
Because I don't care what you say, grandmama's not going to get this. Grandmama's not going to get it. No. You better feed
you're
that
correct.
baby a sandwich.
Right.
What's the matter with you? Like grandma's, you can talk to grandma about the DSM-5. You can tell her about mental health illness. Grandma's not going to get it. You better sit down and eat.
So there's some pressure sometimes within the
Pressure?
Black family.
Well, different because
Absolutely.
the body image is a lot different than what body image would be for Caucasian families a lot of times. I think I'm a very healthy weight, according to my doctor and all other information on the internet. But, sometimes I will come around those family members, Thanksgiving, they'll say something like, have you lost weight? You lost too much weight.
As if
You
there's
need
something
to
wrong with
gain.
it.
Right. There's something wrong with being a healthy weight.
right.
I should be bigger and rounder, I suppose. And so then people will want to pressure me to eat.
You know the funniest thing about it is that you should be bigger and she should be smaller and he should be bigger and he should be smaller. And there's when do we become who we are? Why does it always, and there's always going to be those opinions associated with that, what we should be. And all
Based
those
on
things.
perception.
Exactly.
But it's also power attached to it. Think about it being thin in this culture. There's power attached to it, particularly for white women. And so I think the body image is different in Black culture. I'm so tired of people trying to feed me. I just want to throw a plate at them. And, for Black women, it's the curvy look, it's the fat butt. It's, those... Whereas that's not the same expectations for body image for white women. So I think it's, and females are always trying to attain something and we're rewarded on what we look like in this culture. So body image is a huge part of it. And when you can manipulate your intake to look a certain way, it happens.
How often do we do body shaming? And amongst family, amongst loved
Yes.
ones, not intentionally, not purposefully, but not realizing that we do that. I think
Tell us what is body shaming?
it's when you make a person feel a certain way, good or bad. Body shaming is when you make them feel bad because of their body size, their body shape. We've heard the terms big bone. We've heard the terms
Right.
of
What is
all
a
these-
big bone?
Right, what in the
What
world's
do
a
you
big
mean?
bone?
It's a lot of meat around
I
that
got
bone.
big bones, baby.
Right.
Let me see your ankles.
But
They're my normal ankles.
She's just big boned, y'all.
All right.
That's just
we
how
do a
she
lot
is.
of body shaming, and I think it. I don't know about other cultures. I can't speak on other nationalities and other cultures. I've been in America my whole life, but I think it's funny how we will celebrate weight loss regardless. Like, baby, that cancer did you good. You lost 50 pounds. Woo, child, I'm gonna give me some cancer so I can lose some weight. Like we really think like that. When we celebrate people when they've lost weight, without asking them how they lost weight, why they lost weight, was it sickness? Was it intentional? Was it intentional? I've had families talk to me about their doctors and things that doctors say inside the doctor's office, celebrating weight loss without asking any questions about how you lost the weight, over what period of time you lost the
Are
weight.
you depressed?
Right.
Yes.
Tell me about your relationship with food. Tell me about your relationship with exercise. Tell me about your family dynamics concerning the dinner table and eating and where does food fit into the house. All those different things. But we just celebrate the fact that you lost weight. So I don't care how you did it. You did it.
And we may sometimes criticize and judge those individuals who may have an extra few pounds on them. So we make comments about them and then they feel bad about it. And so that's extra pressure on them.
Or not just the extra few. What if you got a whole lot? What if you got an extra 30 pounds, 40 pounds? So does that person deserve the looks we give them? So you walk into Krispy Kreme, you got a person sitting there who weighs 340 pounds and they're 5'8", eating a Krispy Kreme donut. Then you got a person over here who is 5'8" and weighs 150 pounds. They're eating a Krispy Kreme donut. What do we think about the person who's 340 eating the Krispy Kreme?
Gotcha.
Compared to the person who's 150 eating the Krispy Kreme? They've been here all day eating that Krispy Kreme donut. Look, I bet they've probably had 2 dozen sitting there. We have these thoughts, whether we ever say it or
Some people say
acknowledge
'em.
it. Yeah, but we think these things because a person's overweight, and I just think that's where that body shaming comes in.
It does cross my mind if I see someone who's a little self-disclosure, and the grocery store, someone who's severely overweight, I'm tempted to look in their cart and see, whether they buying it. That's a lot of bacon, for someone who looks like they might need to cut back on the bacon.
With no idea of what's going on in their life.
Right.
And I'm not saying it to say you're wrong, because
No,
we all
I
do
just-
that. And I'm very proud of you
Runs
for
through my mind.
self-disclosure.
Thank you.
Yeah.
How long have you
That
felt
was
like
Being
very
that?
honest about it.
Yeah, how long have you felt like that?
Room full of therapists.
Right.
Or when I go to Krispy Kreme to pick up some donuts and the woman in front of me is clearly over 250 pounds, sometimes I have the thought, should you be in line? And it makes me even wonder, should I be in line, sometimes to buy donuts?
Right.
So it's something that we all do. But I want to hear more about this body image issue with Black women. What do Black women see when they look at themselves, and how is that related to some possible eating disorders? What are you guys hearing? That's what I want to hear.
First of all, I do not think that I don't know how long this podcast is going to. You say, what do Black women see when they see themselves?
That's a whole
That's
nother. We
right.
don't have time for that kind of
That's
answer.
exactly like.
But
Give me a synopsis
real quick, the quick
on
and
what
dirty.
you are seeing. That's what I want to know.
What I'm seeing is
Key points.
food. Like food is just whether it's food or something else. That's the symptom, right? So it's more of a theme of I'm not enough. I'm not enough of something, and whether it's food or alcohol or whatever, that's going to help me in some ways cope or feel better about me.
Sort of like self-medicating.
Yeah.
The food makes them feel good. So it's not always about appearance or trying to fit into a certain body shape.
Right. Well, and the
Okay.
food is a drug, just like anything else. So it physiologically changes your brain, it changes your body, and then that's why it turns into the disorder, right? So, and that's what people don't understand, I think, about just the educational piece of eating disorders. When your body gets used to food just like it gets used to any other medication. And so, when you are altering that, you're altering how your brain is thinking and those neural pathways. So if you're restricting and you're starving your body goes into starvation mode, and your thoughts and how you're thinking is shifting and changing, not for the positive. Very similar on the other side of the spectrum, when you're eating too much. Most of the people that are binge eating, have a major depression diagnosis or something else,
I see.
as well as a medical complication.
Thank you. Because I was just sitting here thinking about it. The holidays are here. Thanksgiving is coming up. And I'm going to eat my banana pudding. I love banana
Cheesecake.
pudding. And cheesecake as well. But at a certain point, I'm going to stop. I may get a larger portion than I usually do because it is the holidays. But at a certain point, I'm going to stop and I'm going to sit down. I'm going to relax. I'm going to allow my food to digest. And I might go out and run a 5K the next day or so. What's the difference between that and the person who continues eating?
Yeah.
What makes them continue eating, although it may not be healthy for them?
I think one of the things with binge eating disorder and with bulimia is looking at how they're eating, and like Crystal said, it's why are they eating? What need is that meeting? The eating or the restricting? Is the restricting meeting some secondary need than just when we eat, we're eating because it's fuel for the body. There's a certain nutritional value that we get from eating. Your body has told you that you're full. You recognize you're full. You might be like, okay, I'm gonna get just one more slice,
Right.
one more spoonful.
Not anymore.
You're like, okay, I'm done now. It's
I'm
here.
done.
I'm done.
But tell me about the person who continues.
Right. Well, that person, as Crystal said, it's either their body is not talking to them, or they're not hearing from that, or it's that they're hearing more from the need that's being met, whether it's the depression or the anger or the frustration or the loneliness. Holidays is one of the, for some people, the most depressing times of the year. So they go through a lot of emotions around loneliness and around, sometimes there's been deaths in the family around this time. So there's a lot of triggers that people experience around the holidays. So you're looking at the binge eating side of it, and you're also looking at the anorexia. So are you restricting? Are you restricting and binging? Are you purging? Is there a compensatory behavior that's following your binging? But all of that is tied in. I don't think you can separate one from the other. I think it all goes to those emotional, where they are emotionally, where they are. I always like to use the word relation. What is your relationship with food? What is your relationship with exercising? You said you would go the next day and run a 5K. If you could not go run that 5K, it was raining, or you just woke up and didn't feel like it, or how much distress would you experience for not running that 5K? Whereas individuals who would feel extreme distress because all they can think about is, I ate X number of calories yesterday. If I don't run this 5K today, then I am going to gain at least 2 pounds or whatever it might be. But they feel extreme distress associated with not having that compensatory behavior because of something that they did, whether it was whatever time frame it was.
I've seen a lot of people pre-plan for eating big meals and, I'll just take a laxative.
Got that laxative in my
Right,
purse.
have that laxative right here.
gosh.
I imagine that during the holidays, a lot of it may be due to stress. I know that I'm one of those people that can stress eat, and if there are a lot of people in my home stressing me out during Thanksgiving, I'll probably eat a little more than I was planning on eating that day. But like Harrison, I'll get out and I'll run that. Not a 5K, that's a little much for me, but I'll run, to take care of all the extra food that I ate. Now, the thing is, it seems like exercise should be the thing that I should do instead of, to take care of that stress instead of eating. Because I think Dr. Burwell, you told us in the last episode, exercise is one of the best ways to combat stress and depression.
Right.
But instead, people will substitute drugs and food, which, as you said, is a drug.
Yeah, absolutely. I think food is the most overused antidepressant, and exercise is the most underutilized because it takes work and effort. But people that are finding themselves in the midst of an eating disorder, what's healthy in terms of their body movement and the intention behind it is very different from someone who doesn't, because you don't want to encourage a ton of exercise if that's going to become habitual and as well. So it's like teasing apart symptoms, which is why eating disorders is so complicated, because it requires a team, a collaborative effort, and a team of professionals to treat so many factors.
So tell us, what do we do to help these individuals who are experiencing some type of eating disorder, whether it's binge eating, anorexia? What type of recommendations can you guys give us to help these folks out?
I think for families, let's look at the people that you have in your intimate circle. Because I honestly, as providers, are you asking as a provider or are you asking as a
provider?
As a provider. That's definitely, I'm going to let you have that,
Oh, yes. Come see me.
What you should do is you should refer them to Dr. Burwell. That's what you should do.
But, Carlos, you mentioned your relationship with food, your relationship with exercise, but really what I focus on, so I would say find a therapist that is trained and specialized in eating disorders, because just because you've seen 1 or 2 clients with some symptoms, and it might have been disordered eating and not a eating disorder, that doesn't mean they know what they're doing. So find someone good, like me, and then be invested in your treatment. It's a process. Food is something unlike any other drug. We face it at least 3 times a day. So you're gonna
you need it.
Food. You don't need weed, but you gotta
food.
eat. If you have a plant, I can't keep a plant alive because I forget to water it.
It's okay.
But just if you don't nurture it, what's it gonna do? What's gonna happen to it? Get help.
And I think you have to remember this body, because I work with a lot of adolescents, a lot of children that are in those pubescent ages, and not understanding that your body needs that nutritional value to do all the functions that it's doing. I think young people, they see themselves walking, their heart beating, they're breathing, and so I'm good. Not realizing, okay, your body's also developing bones right now. It's also building your brain right now. It's also, the organs are still developing. Yes, you're 15 years old and you think you're grown, but your body is still developing. 20 years old, your brain your skull hasn't even closed up yet. So all these things are still happening. What they don't recognize is that because of the malnutrition that they're experiencing, the body goes into survival mode. We actually just had a conversation about that. It goes into survival mode, shuts down, and now I can't put time into developing bone. I've got to make sure the heart is beating and the lungs are breathing. That it's focused on. It has just enough energy to give those pertinent, those vital signs, those vital organs, that vital bodily functions. I've got to focus on that only. Everything else is a luxury. When you don't understand that, it's kind of like trying to drive a car with no gas in it. You're not going to go too far. And that goes back to why eating disorders have the highest mortality rate than any other mental illness. I wanted you asked earlier about myths, and I think one of the biggest myths about eating disorders, which causes the entire family shame, is that it's because of the family. Automatically, moms are blamed. Automatically, the family dynamic is blamed, and that is I think that's the furthest from the truth. And it also keeps a lot of families from seeking help because they're ashamed, they're embarrassed. Mom has lost all her self-esteem. She feels very insecure about her ability to provide for her family and her child. She's watching her child die. And we have a lot of families that come in where we have to work with the parents to rebuild their self-esteem, to ensure them that you are a great mother, you are a great father, you are doing exactly what you need to do for your baby. So I wanted to throw that out there because any families that might be seeing some things, and you have the ability to be the first responder. Do you have a child that always wears a baggy sweatshirt and baggy sweatpants all day, every day, all season, every year? Like, why aren't they showing you their skin? Why aren't they showing you their arms, their legs? Why? I have 5 girls that walk around the house, like forever, like it's summertime, and it's like, So
sounds like my house. It's always
Right,
summertime.
right.
Sounds like my house too.
right. So if you have a child that's forever covered up and always wearing baggy clothing, that's not saying that's
hiding their body.
Right, hiding their body. It's not a warning sign, but it can be a warning sign. It can be a red flag to kind of ask questions and also look for some of the other comorbidities, other symptoms and signs that they may be having. Are they cutting? Is there any non-suicidal body injury that they're experiencing? That could be associated with the eating disorder.
Gotcha.
So, Carlos, you started to talk about what families can do to be proactive. Can you go a little more into that? We know thank you for telling us what we can look for. What are some things that we can do, myself as a parent, to be proactive and protect my children from eating disorders, if there's anything I can do?
I think the first thing would be realistic. Because you have your babies, and we give those who we love a little more room for failure and mistakes and to mess up. But just being realistic and asking questions like, does she go to the bathroom every day after dinner? Every day. Do we eat dinner together? Do everyone eat separately in their room? When's the last time I actually saw him eat? When's the last time, how do they act around exercising, things of that nature? Being able to say and ask those questions and ask about food and body image. Asking, from what I've seen, is self-esteem is probably one of the biggest factors to be able to gauge your family members. And we know family members who have great self-esteem, and then we know family members who don't. And you can see it in how they carry themselves. Maybe not around the family nucleus, because we have this certain amount of comfort around family. But how are they in other settings? How are they in school? What do their teachers think about their behavior and their interaction at school? So being able, I think, ask honest questions and then dealing with some hard situations. What would you do if you felt like your child was addicted to cocaine? What would you do if you felt like your child had an eating disorder? I think there's some similarities. Obviously, the biggest is, as Dr. Burwell said, you can live without cocaine. You can't live without food. But being able to just ask those hard questions and then having a plan for what comes out. And it's got to be, most importantly than any and everything else, in a loving, accepting environment. That's more important than anything else. That regardless of where you are, who you are, what you are, I love you, and that's never going to change. Now let's have a conversation.
Gotcha. And that's what the families, trying to recognize some of those warning signs. But Crystal, what can a friend do if we're noticing some of these signs with a friend or a loved one or family member who's an adult? What can a friend or coworker do to help out someone who may be experiencing an eating disorder?
For an adult, I think really, like Carlos was saying, it's your approach and coming from a place of love, because it is a really sensitive topic, and you're talking about like your body, your temple, like what you carry around with you every single day. And especially, for women, that's another layer. So I think, making sure your delivery is in a loving way so that it's a safe space to begin that conversation. So, yeah, I would just encourage, if you see red flags, like, significant weight loss or weight gain, because sometimes we're quick to comment on the weight loss and celebrate that, but maybe not so quick to comment on weight gain. But because those are, hallmark factors for anxiety and depression, I think it can be less about the fact that, hey, your body's changing, but, hey, I've noticed that maybe you seem a little down lately, or maybe you're stressed about X, Y, or Z. how's that going for you? Because what's important, this clinically comes back up to the surface. So if you miss it, it's going to keep coming back up. So you just have to be thoughtful in starting that conversation and realizing that you're not the therapist and you need to help a person get help.
Okay, so before we leave, I want you all to quickly touch on any of these fad diets we should be avoiding, just in case, someone is thinking, okay, I'm listening to all this stuff about food, but I already have, I'm going to do the keto diet, or I'm going to I'm going to do the 10-day smoothie cleanse or something right after or before Thanksgiving to prepare or to undo the damage that they did. What are some of the things that they should be avoiding?
I'm going to do the Jesus diet. It's where you die. It's where you die. You come back 3 days later.
Yeah, that's how it sounds to me. And that's part of that. I'm a man. Mm-hmm. And so I know that I'm not typical in my thoughts. I'm a man, I have great metabolism, good genes, all that. So there's a lot of things I don't experience that people do.
Right. You don't
nice.
go through what women go through.
Exactly.
Yeah.
And I respect
struggle
that.
Is real.
I throw it out there first and foremost because I want to say I do acknowledge that as women, Black women especially, and I say that especially because that's the point that you made earlier, the society that we live in, the culture that we live in, our culture is a subculture in the greater American culture. And so our bodies are not the norm. And I think that's one of the biggest issues with eating disorders is that we are trying, oftentimes our perception of beauty is not from our perception. It has been defined by somebody else, and now we're working to look like this
Eurocentric idea
of what beauty is. Right. We don't accept ourselves. We don't accept our hair. We don't accept our
Wait a minute. That's
features.
Another talk. That's another podcast, Carlos.
I know. I'm sorry. I'm going there. As far as the diet, this is like, to answer your question.
Yes. Please.
When it comes to food, I think one of the issues is that we see food as having these human attributes. Like that Krispy Kreme donut robbed the bank yesterday. So it's a bad donut. Donuts are bad because they robbed the bank, Well, donuts have never robbed the bank. So there's no such thing as bad donuts. There are donuts and there's broccoli. So which one's good? Which one's bad? Well, broccoli has a certain amount of nutritional value. Donuts have a certain amount of nutritional value. Obviously, the broccoli has more nutritional value from someone's perspective. But does that mean that donuts don't have any nutritional value whatsoever? There's so many different things we have to take into place, and I think we give these attributes to food: good food, bad food, and so we talk like that. So if there's good food and bad food, then there's good diets and bad diets, and there's good body size and bad body size. Everything's good or bad. I think it's all about moderation. I can't tell you how to eat no more than you can tell me how to eat, because there's certain foods that are going to affect your body different than how it's going to affect mine. And I think we have to look at it from an individualized perspective. What is good for me, and move forward from there.
Thank you.
Oh, yeah, just to add to what you said, yeah, good or bad, I always say effective or ineffective. Like, you're right, the donut and the broccoli, they both have nutritional value, but in terms of, like, the underlying emotional stuff, like, is this effective for you to eat or is it not effective? Is it going to be helpful or is it not? And also, diet is a 4-letter word, just like other 4-letter words, and it's not sustainable. And so really just being able to understand your nutritional needs holistically, and not just looking at, Thanksgiving's coming up, or, just looking at it.
Your lifestyle.
Your lifestyle from a
change.
wellness perspective. Yeah.
Well, thank you guys for giving us some valuable information about eating disorders and how it looks within the Black community and what's going on within the Black community with our relationship with food and our relationship with our families.
Please let our listeners know where they can find you, how they can get in contact with you too.
They can always go to my website. I do several different things outside of the mental health field. As you said, I love performing arts, so I have a website, mhpfilms.com. You can always find me on Instagram, The Filmmaker, Facebook, Carlos Houston. That's Carlos with a U, Carlus. That's about it.
The O is silent.
There is no O.
There's no O.
What about you, Dr. Burwell? I know you've started your bariatric groups and you were moving to a new location. So please remind our listeners where they can find you.
Sure. You can check me out at enchantedtherapeuticcounseling.com. So, yeah, I have an office in Sandy Springs, and we're hoping to have an office in Buckhead in the first of the year. So you can check me out online.
Thanks. And as always, you can find us at www.2therapists, spelled out with an S.com. You can also find us on Facebook, iTunes, and Spotify.
All right, guys, we will see you next time.